Hi, I'm Dr. Rex Chang.
I'm Dr. John Ruling.
I'm Dr. Liz Broussard, and we are your PACMed GI care team.
Good morning. This is the nurse calling from Dr. Broussard's office at the PACMed Ambulatory Surgery Center regarding your colonoscopy scheduled for 1 week from today. Check-in for your procedure is 10 a.m. on the 4th floor of the 1101 Madison building. We ask that you arrive as close to your check-in time as possible to avoid overcrowding in the waiting area. Please have a driver over the age of 18 available to drive you here and drive you home. If your driver is not available at time of check-in, we just need to speak with them by phone prior to starting your procedure. You can park in our parking garage with entrances on Marion Street and Minor Avenue, and we can fully validate your parking. We just ask that your driver not wait in the car in the parking garage as there's no cell phone service. Please give us 2 to 4 hours from time of check-in to time of leaving the recovery area. And if you have tested positive for COVID-19 within 30 days of your procedure, please call us at 206-505-1080 as your procedure will need to be rescheduled. 5 days before your procedure, please do not take ibuprofen, Advil, Motrin, Excedrin, naproxen, Aleve, meloxicam, or any full-dose aspirin products. Baby aspirin is fine to continue. 5 days before your procedure, please stop eating foods containing nuts, seeds, corn, beans, or peas. The day before your procedure, you're going to be on clear liquids all day, no solid foods. At 6 p.m., you'll drink the first half of the prescription laxative. You can drink 1 8-ounce cup every 15 minutes until 2 liters is completed. And be sure you are close to a restroom as this laxative will induce diarrhea. The morning of your procedure, 6 hours prior to your procedure, take any morning medications. 5 hours prior to your procedure, complete the remainder of the prescription laxative. It will induce diarrhea again, and please complete all of the laxative even if your bowel movements are clear. You can drink clear fluids up until 3 hours prior to your procedure. After this time, nothing at all to drink, nothing in your mouth, including gum, mints, or tobacco. If you take a medication called phentermine, please hold this for 4 days prior to your procedure. Leave all loose jewelry from the neck above at home, and be prepared to take out any contact lenses prior to starting procedure. If you have any questions regarding these instructions, please call us at 206-505-1080. Otherwise, we will see you in 1 week's time for your procedure. Thank you. Bye-bye. Hi, good morning. My name's Libby. I'm going to be taking you back to the admit area.
Are you going to be driving home today?
Yeah.
All right, so we're gonna have your driver wait downstairs on the first floor lobby, and we will give them a call at the number that they've provided to us when we're all done with your procedure. Follow me. Come on in. I'm gonna have you come in this room here. All right, so can you spell your last name for me, please? And your date of birth. Wonderful. We'll put this name band on your left wrist. And can you verify the procedure you're here for today? Wonderful. Okay, so I'm gonna step out of the room and let you get changed. You're gonna take everything off. The gown will tie in the back. You can put your clothing in the provided patient's belonging bag, socks on your feet. Please leave your mask on. You can leave your glasses on as well. We have a restroom just across the hallway should you need to use it. When you're changing, please close the door, open it a crack when you're all ready to go, and that'll let us know that we can come in and get you ready to go. When I come back into the room, we will review your health history. We will take a set of vital signs, place an IV in your arm or your hand, which is how you will receive the sedation in the room. And you will be seen by the doctor and the nurse anesthetist. The nurse anesthetist will be providing your anesthesia. And that would be the time when you could ask any questions you have for either of the nurse anesthetist or the physician. Do you have any questions before I step out of the room? Okay, wonderful. I'll step out of the room, close the door to change, open it when you're ready for me.
Hi, good morning. I'm Dr. Broussard. I'll be doing your colonoscopy. This procedure will take about 30 minutes, and you're going to be asleep the entire time. There are some risks we should talk about before we start. The risks involved include infection, bleeding, and accidentally damaging the lining of the colon. The risk of that happening is quite small, less than 1 in 10,000. After the procedure is done, I will come talk with you and review the pictures that I took during the procedure. If I take off any polyps or growths from the colon, I send those to the lab, and then they send the results to me, and I send those to you with recommendations on when I need to see you back, probably in the next 7 to 10 days, either my chart or a letter in the mail. Do you have any questions or concerns before we proceed? Okay, I'm gonna have you sign this consent form and put the date and time. And then after I'm done, I'll have our CRNA come talk with you about how she's gonna put you to sleep for the procedure, and then we'll get started.
Hi, good morning. I'm Casey. I'm a nurse anesthetist. I'll be doing your anesthesia today. Nice to meet you. I've looked over your history. It looks like you don't have any breathing issues or heart problems, no allergies to medications, and any problems with the anesthesia in the past? Wonderful. Today we're doing a colonoscopy. Have you had one before? So what we'll do is a deep sedation. I'll give you some medicine in your IV. You'll be asleep and comfortable. You'll still be breathing on your own the whole time. The medicine we use is wonderful because it wears off quickly. Once we're all done, you'll wake up in about 5 to 10 minutes. The risks of anesthesia are extremely rare. They include any reaction to the medication, heart or breathing problems, but we'll be monitoring you very closely. Do you have any questions about the anesthesia? No? All right, thank you. I have a consent for you to sign. Just going over everything we just talked about.
Hello, welcome to the room. I'm Riley. I'm the nurse in the room. This is Elaine. She will be assisting. I will take your bag, and I'll have you come stand right here. I'm going to put your bag underneath the bed and then lower the bed down. We're closing the door behind you, if you'll stand right here. We're going to untie the side of your gown. We want you to open up the flaps and sit bare bottom onto the bed. Then you can lay on your back. I'm going to be attaching some monitors to you. We're going to be putting a blood pressure cuff on your left arm. It's really cold and it's going to get tight. I'm going to put a pulse ox on your right finger. We will put leads on your arms. Good. I'll put this railing up, and Elaine will put oxygen on your nose.
Okay, I'm gonna put some oxygen tubing in your nose. It's gonna go around your ears, and there's a part that's gonna sit right on your lip here that just tells the nurse anesthetist that you're breathing.
Can you confirm your name and date of birth for me, please? And which procedure are you getting today? Good. Any metal in your body? Any plates or screws anywhere? Anything loose or removable? Hearing aids, dentures, retainers, glasses, contacts? Any medication allergies that you know of? Perfect.
All right, I'm going to hook some IV fluids up to your IV. And now I'm going to get you into position for the procedure. So I'm going to lower your head down. I'll have you turn all the way on your left side facing me. Good, and bend your knees up towards your chest. Perfect. Now I'm gonna start giving you that medicine so you get sleepy. We're gonna take really good care of you and we'll see you when you wake up.
Hello, my name's Tyler. I'm your recovery nurse today. You're just waking up from your colonoscopy. You can keep resting for now. I'm gonna go ahead and gather your paperwork and call your driver, let him know you're all done with your procedure. In the meantime, think about whether you want some water or juice, and I will be back with that shortly. All right, I have your juice right here whenever you're ready to drink it. I'm gonna let you wake up for a few minutes and then we can go over the paperwork together, talk about the procedure. Your driver knows that you're here and they are ready for you outside. I'm gonna get another vital signs in about another 15 minutes, and after that, we'll see how you do walking and if we can stand and get dressed.
Well, your colonoscopy was completely normal. I'm so glad you came in today. I'd like to see you back in about 10 years. You did great. You'll feel a little woozy today, but you'll be back to normal by tomorrow. Do you have any questions or concerns? All right. Well, it's very nice to meet you. Take care, and we'll see you soon. Okay, bye.
All right, the last thing I have for you is a parking voucher. It's gonna get you out of the parking garage for free. I'm gonna hand that to your driver and explain how to do it. But basically, you're just gonna take the parking ticket at the gate, scan it, then you'll scan this barcode right here, and it'll get you right out of here. All right, I see you're all dressed and ready to go. I have your paperwork right here. So I'm just gonna stand close to you as we walk out to your driver who is ready out there for you. And you're doing well on your feet, it looks like. That's great.
Oh, sorry.
And we have your driver right here. All right, so this is your parking voucher to get out of the garage today. I have all this paperwork with them. What you're gonna do when you get to that gate is scan your parking ticket, then scan that, and it's gonna open right up for you.
Okay,
All right, you guys have a safe trip.